Hi there, welcome to Aurora College, School of Health and Human Services. My name is Wanda Roberts and I'm the Program Head for Health Programs here at Aurora College. Let's take a little tour of the Yellowknife Campus Health and Human Services program area today. This is our computer lab. In the BSN program, students need to write computerized exams. So this space is a classroom that can actually be transformed into a computer lab. This came in very handy during COVID when there was a lot of online learning. In the BSN program, students need to prepare for their NCLEX licensing exam. So in order to help students prepare for their NCLEX exam, the BSN program at Aurora College has implemented and integrated a lot of online exams. It reduces anxiety for students and helps them to be better prepared to write their exam at the end of the program. So let's take a little walk down the hallway. The students in the BSN program, one of their community courses, their instructor would provide them some opportunities for alternative ways of evaluating learning. And so the students actually co-constructed these quilts with their instructor. In the fourth year, nursing students will also complete research projects and poster presentations as part of their research course. So we proudly display past projects that students have completed. They can choose a topic that resonates with them. This used to be the nursing lab. This space only had room for about 4 to 6 beds, and our current lab space is probably at least double this size, much brighter, and has some high fidelity simulation equipment in it. Okay, let's go see the lab space. Welcome to our nursing lab. This is where the magic happens. Most students in the Health and Human Services programs really enjoy the hands-on part of learning, and this is really where students get a feel of what it's like to be in healthcare. So we have isolettes for people who will be working to provide infant care. We have equipment that students would be exposed to in the hospital setting. They have an opportunity to practice here in the lab before they go out to actually practice with real patients. So we have a lot of mannequins. This lady is one of our high fidelity simulation mannequins. A number of our mannequins are actually computerized so they can talk to you. They have vital signs, so when a student practices blood pressures or is practicing IV insertion, the mannequin will actually have a blood pressure they can get a reading on. We have some lifts that were generously donated to us by Avens, the long-term care home here in Yellowknife. They were buying new patient lifts, and so they donated some equipment to us. This is a crash cart. It's a simulated crash cart. This would be a cart that is taken to a nursing unit when someone is in cardiac arrest or having a medical emergency. Students get to practice here in the lab skills that would require them to access the crash cart to help them learn how to respond in an emergent situation. So in our lab, we try and create as realistic a space as possible. So we have IV pumps that are similar to those at our practicum sites so that students get to practice here with how to use the pump and how to hang the IV bag, how to insert IVs, so that when they're caring for someone in practicum, they're well versed before they head out into the real world. So this is one of our high fidelity simulation mannequins. This mannequin can breathe and talk, has vital signs. Again, you can see that there's an IV inserted in their arm. This is actually hooked up to a computer. So when we conduct a simulation, we actually have a screen here that would show the vital signs from the mannequin, just like a monitor in maybe an intensive care unit. It might have their ECG reading so that students have to interpret what they're seeing on the screen and practice critical decision-making skills right here in our simulation lab. So when this mannequin is connected to the computer system, an instructor can actually manipulate their vital signs so that maybe it looks like the person is hemorrhaging, or it's maybe somebody's blood pressure is really high. Students have to think about what they would do in that situation and problem solve their way through it. So we have the computer screen, we have the IV pump, and we also have some simulation of oxygen and medical air hookups that are very similar to what you would see in a hospital setting so that students can practice some of those skills, administering oxygen to a patient when they need it, maybe doing some suctioning. So all of that is set up very similar to what you would see in the hospital. So this is our simulation control room. During a simulation, this is where an instructor would be controlling maybe the mannequins, manipulating their blood pressure, speaking for them through a microphone. So it's kind of where the magic of simulation happens, is behind this door. As you can see, we have a lot of lab supplies. So we have a room dedicated to storing all of our medical and healthcare equipment. So this cart is what we would call a mother cart or a supply cart in some nursing units. It would be where the nurse goes to, or the support worker, to pick up their supplies for doing a dressing change or caring for their client. Included in our lab, we actually have what's called simulation medications. So students can practice things like medication administration here in the lab using pretend medication. These are called neuro kits. So these kits contain everything that the student nurse needs to do a neurological assessment. So students can come into the lab and pick up one of these kits, and then they practice the neuro assessment on their peers in the lab before they go out to practice. We have injection pads that students can practice doing injections with needles. We have lots of different body parts that are used for practice. There's multifunctions to this type of pad. There's an artificial vein there that students can practice palpating or feeling. They might practice suture or staple removal on these wounds. So we also have models that students would learn the anatomy and physiology of the heart to help them really understand. Thank you for visiting the School of Health and Human Services today at Aurora College. If you're thinking about a career in healthcare, Aurora College offers the Personal Support Worker program, the Practical Nurse program, and the Bachelor of Science in Nursing program. Go to www.auroracollege.nt.ca and get connected.